So welcome everybody to the Climate and Health Responder course. My name is Cecilia Sorensen, and I'm the director of the Global Consortium on Climate and Health Education. This 5-week course is designed to give you the tools that you need to effectively respond to the climate and health crisis and to facilitate network building and collaboration. So thank you all so much for being here from all over Latin America, from all over the world, from so many different professional backgrounds. This is just incredible to see. And I think that this tremendous turnout today speaks to the urgency and the importance of why we are here today. We had to find a new Zoom room to accommodate so many people who are interested in this. We have had over 3,000 people sign up for this course. So this course is a tremendous collaboration between the Global Consortium on Climate and Health Education at Columbia University, the Inter-American Institute for Global Change Research, and the Pan-American Health Organization. So thank you all so much. Just so you're aware, there is live interpretation. There is a globe at the bottom of the screen. You click the globe and you can select the language. The majority of this course will be in Spanish. Some of it will be in English. So as you log in, please select whichever language you prefer. And now I'd like to give a special thanks to our leaders, Dr. Linda Freed, who is the Dean of the Mailman School of Public Health at Columbia University, Dr. Agnes Suarez de Silva, who is the Regional Advisor for Environmental Epidemiology at the Pan American Health Organization, and Dr. Marcos Regis de Silva, who is the Executive Director of the Inter-American Institute for Global Change Research. Thank you to our leaders, and I'd like to share with you a special welcome from each of them.
Greetings and welcome to all the participants in this very important program. Over 2,000 of you from South America and globally. I'm Linda Freed. I'm the Dean at Columbia University's Mailman School of Public Health, and I'm honored to join in welcoming the tremendous participation by all of you and the collaboration that underpins this work between the Mailman School of Public Health and its Global Consortium on Climate and Health Education, PAHO, and IAI. Climate change, we all know, is a reality, one with very serious health consequences affecting physical and mental health, morbidity, mortality, well-being, and society's abilities to deliver healthcare and support healthy living. The effects of climate change are already harming health around the world, and impacts we know will only intensify in the coming years. Heat waves and rainstorms are becoming more deadly. Disease outbreaks last longer and are seen in new regions. Wildfire smoke from tinder-dry forests reduces air quality and harms lungs and hearts and kidneys. And food and water security are threatened by extreme weather and by drought. We, as a global community of public health and clinical professionals and researchers, health systems leaders, students, and health policy leaders, we all must respond to these unprecedented challenges in a coordinated and urgent fashion. This course, the first of its kind, is a crucial step in mounting a health system-wide national and global response. Through this course, we hope that you will gain the skills and knowledge you need to engage in research and programs which inform health policy, solutions, action, and implementation. So I thank you all for dedicating your time to this very important initiative as we join forces together. I look forward to this powering our collective success in protecting lives, health, and all of our futures. Thank you.
Soy la doctora Agnes Suárez, soy médica, epidemióloga ambiental y jefe interina de la Unidad de Cambio Climático y Determinantes Ambientales de Salud de la Organización Panamericana de la Salud. Me gustaría dar las gracias a la
I would
Melbourne
like
School
to
of Public Health
thank
de la Universidad
the
de
Melbourne
Columbia,
Public School of
al
Health
Instituto
at the
Interamericano
Columbia
para la
University and the
Investigación del
Inter-American
Cambio
Institute
Global
for Global
y a los
Change
académicos y
Research,
otros
and
profesionales
the
que
academics
prepararon
and the
las
professionals who
clases por
prepared
hacer
the
posible este
classes,
curso de
the lessons to
capacitación.
make this training course possible.
También les tiendo un
I also
sincero
truly
agradecimiento
thank
a
you, the
usted,
participants, for your
participantes,
interest
por
in
su
health
interés en la salud y el
and
cambio
climate
climático
change in
en
Latin
América
America.
Latina. La OPS reconoce
PAHO
que ha habido
recognizes that there
avances en
has
las
been progress in
acciones de
mitigation actions
mitigación
and
y de
health sector
preparación del sector
preparedness for
salud
climate
frente al cambio
change.
climático. Aún
It also
reconoce
acknowledges
más los desafíos regionales. Y con este
further
curso,
regional
elaborado en
challenges. And
colaboración
with
con
this course
expertos en
developed
el
in
tema
collaboration with
de
experts on the subject from
instituciones
recognized institutions in
reconocidas
our
en nuestra
region,
región,
and through
y
a
con un
collective
esfuerzo
effort,
colectivo, espera
we
mejorar
hope
la
to
capacidad del
improve the
sector salud
capacity of the
en
health
actuar
sector
frente
to
al cambio
act
climático.
in the
La
face of climate
capacitación de
change.
profesionales de salud,
Training of health professionals and
investigadores,
researchers,
investigadores
environmental
ambientales,
researchers, health leaders,
líderes de la salud,
academic students,
académicos, estudiantes y
students, and
financiadores,
funders
es
is
esencial
essential for
para
the
dar
joint
respuesta
response that
concertada
is
y
needed.
confeccionada que se hace necesaria. El cambio climático es la mayor
Climate change
amenaza
is
sanitaria
the
mundial del
greatest
siglo
global health
XXI,
threat of the 21st
y la
century,
lucha contra
and
el cambio
combating climate
climático
change is one
es
of
una
our
de nuestras
greatest
mayores
opportunities to build and
oportunidades
strengthen
para
public health
construir y
systems.
reforzar los sistemas de salud pública. Los fenómenos meteorológicos
Extreme weather
extremos
events can
pueden
directly
aumentar
increase
directamente los
heat-related
efectos
effects
relacionados con el calor y la prevalencia de
and the
algunas
prevalence of some
enfermedades y causar
diseases that
lesiones,
cause
pero también
injuries, but
fatores
also
climáticos
climate
cambiantes
factors can
pueden
affect
afectar a la
health
salud al
by
exacerbar la
exacerbating food
inseguridad alimentaria,
insecurity,
la migración de la
population migration,
población
and
y
mental
la salud
health.
mental. Y también cambiar
They can also
patrones de
change the
transmisión de
transmission
enfermedades
patterns of
transmitidas
vector-borne
por vectores,
diseases,
zoonoses y
zoonoses, and access to
el
quality
acceso
water.
a agua con calidad. Las personas
People
viven en la
living in
pobreza,
poverty, in
condiciones
precarious housing
precarias de
conditions on
vivienda y
small
de
islands in
poblaciones
coastal
tradicionales
areas,
costeras, los indígenas y
indigenous
otras
and other
poblaciones
traditional
tradicionales
populations
tienen un
have a
mayor
higher
riesgo de
risk
sufrir
of suffering
fenómenos
more frequent and
meteorológicos
severe weather
más
events.
frecuentes y graves, y la subida del nivel del
And
mar, junto
also
con una menor
sea
capacidad de
level
adaptación a
rises
los
because of a
problemas
lower capacity
existentes,
to adapt to
tanto en
existing
materia de
problems in the areas
infraestructura,
of
saneamiento, como
infrastructure,
también en
sanitation,
los
and pollution
aspectos de
control.
control de contaminación. Por ejemplo,
For
aproximadamente
instance, approximately
131 millones de
431
personas en
million
las
people in the
Américas
Americas do not
no
have
tienen
safe
cobertura de saneamiento seguro,
sanitation
y
coverage.
ese número, casi
And
10
of that
millones,
number, almost 10
aún
million people
practican la
continue to practice
defecación al
open
aire libre.
defecation.
161 millones de
161
personas
million people
no
do not
tienen
have
acceso
access
a
to
fuentes
safely
de
managed
suministro de agua
sources of drinking
potable
water
gestionada de
supply.
forma segura, lo que provoca unas
This
30.000 muertes
results in an
evitables cada
estimated
año. Todo esto es exacerbado
30,000 preventable
por
deaths every year.
los efectos
All
del
of
cambio
this is
climático.
exacerbated by the effects of
La
climate
contaminación
change.
del aire doméstico y ambiental
Household
está
and ambient
relacionada
air
con casi
pollution is linked
400
to almost
320.000
320,000
muertes
preventable
evitables
deaths a year
al
in the
año en la
region
región,
due
debido a
to
enfermedades como
diseases
derrames
such as
cerebrales, enfermedades
stroke,
del
heart
corazón,
disease, lung
pulmonares y
disease,
cáncer.
and cancer.
Aún casi 80 millones de
Nearly
personas
80
siguen
million people
dependiendo
still
de
rely on
combustibles
polluting fuels such
contaminantes
as wood
como
and
la leña, queroseno,
kerosene
para cubrir sus
for their
necesidades de
heating,
calefacción,
lighting, and
iluminación
cooking
y de la
needs.
cocina. Y eso
And that
lamentablemente
affects
es lo
women and
que
children the
más
most,
afecta a mujeres y niños,
including
inclusive incrementando el
increasing the
riesgo
mortality risk
de
of children
mortalidad
under 5 years of
abajo
age.
de 5 años. La gente sigue estando expuesta a
People continue to
sustancias
be
químicas
exposed to
peligrosas
hazardous
como
chemicals
mercurio,
such as
plomo,
mercury,
plaguicidas,
lead, and
que no solo
pesticides that
afectan
not
la
only affect
salud
the
de las
health of
personas
those
directamente
directly
expuestas,
exposed, but
sino
also
también la de
harm
niños no
unborn children
nacidos
who may
que pueden
suffer
sufrir efectos
lifelong
nocivos a lo
health
largo de toda su
effects.
vida. Para abordar estos
To address
retos
these
y
challenges and to
ayudar a
help
sus
member
Estados
states
miembros en el camino a seguir,
on the
la
way
OPS
to
lanzó el año
way ahead of
pasado
us,
la Agenda para
PAHO
las
launched
Américas sobre
last
salud,
year the
medio ambiente y cambio
2021-2030
climático
Agenda for the Americas on Health, Environment,
2021-2030.
and
Esta
Climate
agenda se
Change.
basa
This
en los
agenda builds on the
compromisos
commitments
establecidos en la
set
Agenda de
out
Salud
in the
Sostenible para las
2030
Américas de
Sustainable Development Agenda for the
30
Americas
y también en
and
los
on the
Objetivos de
Sustainable
Desarrollo
Development
Sostenible.
Goals.
Esta agenda está centrada en tres líneas
This agenda
básicas,
focuses on
que
three
es
basic
mejorar el
lines
rendimiento de los
to
programas
improve
de
the performance
instituciones de
of
salud
environmental
pública
programs and
ambiental,
institutions,
programas y
environmental public
instituciones de
health
salud
programs
pública
and
ambiental,
institutions,
fomentar sistemas
to foster
sanitarios
sustainable and
sostenibles y
resilient health
resilientes
systems
a
in
los
the face of
efectos del
climate
cambio
change,
climático y promover
and promote
ciudades y
environmentally healthy
comunidades
and resilient
ambientalmente
cities and
sanas y
communities.
resilientes. Al completar este curso,
Completing this course will
ayudará
help you
a
achieve
alcanzar
these
esses
goals
objetivos al ser
by
capaz de
engaging in
participar en
activities that
actividades
inform
que
health
informan
policy
sobre la
action
acción
and
y la
implementation.
aplicación de las políticas de salud, mejorar la generación
Also,
y uso de
to help improve the
evidencias para
generation and
las
use of
políticas
evidence for
públicas
public
y
policy
mejorar la
and improve
comunicación para
communication to
promover la
promote awareness
concientización
and
y
action.
la acción. Esperamos que
We hope you
disfrute de
enjoy
este
this
curso
course and
y que
use the
utilice
knowledge
los
gained
conocimientos adquiridos
to
para
promote
promover la salud
the
de las
health of the
Américas.
Americas. Thank you.
Gracias.
This course and your participation is much appreciated. A few words about my organization. We are the Inter-American Institute for Global Change Research, or rather the II. We are an intergovernmental organization with 19 parties in the Americas. A party, of course, is a government that has ratified the agreement that established the II. We promote transdisciplinary research and the enhancement of capacities to improve public response to global environmental change. And these responses are based on scientific excellence, international and intersectoral cooperation, and the open and free exchange of knowledge and information. Climate change is perhaps among the many challenges that we face, one of the greatest threats to human health in the 21st century. And many of these impacts are yet to be addressed globally, including in Latin America, where socioeconomic and health inequities have contributed to a rising unequal burden of disease related to this phenomena in requiring knowledge-based decision and policymaking. And this is where transdisciplinary research and the types of, how can I put it, the types of cooperation that we've had established throughout our region is so important. The II expects this course to be a major pillar for academics, health researchers, environmental researchers, health professionals, and others, including climate professionals and leaders, students, and the funders in our search for better methodologies and data to monitor and access the impact of climate change on health, and to develop early warning systems and interventions. In particular, we want participants to learn how to research on climate change and health can generate information that can be used by the health sector to inform adaptation and mitigation actions. The II welcomes and thanks participants for their efforts to identify meaningful solutions to address the threats posed by climate change to the health and well-being of people, in conjunction with the protection of other life forms, including wildlife and ecosystems. Thank you very much, and once again, welcome to the course.
So thank you so much to our leaders. And I'd also like to give a special thanks to our working group, Dr. Anna Stewart, Irene Torres, Dr. Gilma Mantilla, Dr. Daniel Booth, Dr. Carlos Barboza, Haley Campbell. It's been incredible working with you, and thank you all so much for your effort in making this course possible. So the overarching objectives of this course are to equip you with a knowledge base regarding the impacts of climate change on health. We want to make sure that you understand current methodologies and approaches used to establish connections between climate change and health, and enable you to engage in research and practice that informs health policy and the implementation of measures which improve human health in the face of climate change. And so to achieve these goals, we've developed a 10-session course, which will be taught by regional and global experts over the next 5 weeks, every Tuesday and Thursday at this time. Today, we'll be hearing from Dr. Gilma Mantilla about an overview of climate change and health. And then the subsequent weeks, we'll be hearing about climate vulnerability and risk, degraded air quality and wildfires, temperature extremes and climate change, El Nino, La Nina, and extratropical cyclones. We'll be hearing about food and water security. We'll be hearing about vector-borne and zoonotic diseases. We'll be talking about data collection and surveillance. We'll be talking about climate adaptation and mitigation, and we'll be ending with regional climate and health guidance. So now a little bit of logistics about the course. So each session will be 90 minutes. The first 60 minutes will be our lecturers speaking, and the second 30 minutes will be a moderated Q&A. So please put your questions in the Q&A function, which can be found on the toolbar in the webinar. The primary language of this course will be Spanish. However, we will have live interpretation provided in both English and Spanish. All of our sessions will be recorded and posted within 12 hours, and the slides from all our lecturers will be made available on the course website. Another important note is that each of our experts has curated some suggested reading materials that will also be posted on the course website, so you can prepare and also follow up after each session. So as I mentioned, all of this course information is available on the Global Consortium website. The link for that is in the chat right now. We recommend that you bookmark it so you can always find it if you need it. On the course website, you will also find the schedule, the links to all the speaker bios, the recordings of each session, the slides, as well as the suggested reading assignments. So again, that link is in the chat right now, so you'll be able to see all this information right in front of you on our website. We are also offering a certificate in climate and health for this course. In order to qualify for the certificate, we ask you to attend at least 7 out of 10 of the sessions, and then there will be a brief quiz at the end. If you do these things, we will give you a certificate in climate and health on behalf of the partners of this course. Your attendance will be automatically recorded when you sign on, so please make sure to use your own link to sign on, because that's how we'll be keeping attendance. At this time, unfortunately, there's no opportunity to make up missed classes, so please try to be here if you can. And as I mentioned, all the recordings will be posted after each session. So this is the first course of its kind in the world. And because of this, we are really trying to understand what is working, what's not working, and how we can improve it. Therefore, we'd love to collect your impressions as we start this course, and we'll be asking you these same questions at the end, as well as 6 months from now, to see if our course is working and how we can improve it. So please follow this link right now. The link is also in the chat. You can scan the QR code, and there's 3 questions we'd like to ask you as this course gets started, so we can understand where you're coming from and how we can improve the course. So we'll give it about 2 minutes right now for everybody to go to the link and to answer these 3 quick questions, because we'd love to track these questions over time and see how this course is making an impact. So thank you all so much for filling out this brief survey. So there's 2 ways to access the survey. There's the QR code, which is on this page right now, which you can scan on your phone. You could also go to the link, which is in the chat right now, to answer these 3 quick questions. So thank you all so much. And now I'd like to turn it over to my colleague, Dr. Daniel Buss. He is the Regional Climate and Health Advisor for the Pan American Health Organization. Thank you all so much.
Gracias, Cecilia. Podemos cambiar quizás al...
Thank you, Cecilia. Let's switch to Spanish. There are several questions, Cecilia, in our chat, and they're requesting for the link. Could you please share?
Some people didn't have the chance to scan the QR code, but I've seen that.
Absolutely. We just put the link in the chat one more time, so you can follow the link that's in the chat right now.
Bueno, el enlace está en el chat. Si prefieren.
You can see that link in the chat box, so you can very quickly answer these 3 questions, so we can then follow up on them, we will ask the same 3 questions at the end of the course. Thank you. Okay. I see that people are asking about attendance to the course, how you register, and the lengths. So all of these housekeeping questions, I would say, about how the course works, you can find information on our website, on the courses website. You'll find a lot of key information to answer some of these questions about the course and further answers with regards to these housekeeping issues. Let us now begin the course itself. I see Gilma is getting ready to start with her lecture and the more technical side. First of all, I want to thank you all so much for being here. We have almost 800 people online. We hope that throughout the course, in these 5 weeks, around 3,000 people should join us. 3,000 people have registered. Some people are saying that you cannot hear. Maybe you should toggle with your interpretation button and that you should be able to hear it. Okay, let me introduce you to Gilma Mantilla, who will lead today's session, the introductory session, and the links between climate change and health. Gilma is not only our friend, but she's also researcher at the Research Institute for Climate and Society and Global Consortium on Climate and Health, and it is a professor at Pontifical Universidad Javeriana in Colombia. And she is also part of the peer review team for field epidemiology. She's a doctor, she's an epidemiologist with experience in research and public health policies, disease monitoring, and she does applied research to produce climate sensitive disease profiles. And that is a very brief summary of her very vast experience. So without further ado, let me hand the floor over to Gilma to begin with the course. Thank you again so much for being here with us. Gilma, you have the floor. Great, thank you. Good morning, everyone. I am so excited to start this course. I think this is very much in need. We need the different organizations that have joined us and have organized this course show that this is true, and I will make the best effort to provide a general overview on the link between climate change and health. So let me begin by sharing my screen, and then we can begin with our presentation. So what we will be discussing today is a very general overview on climate change and health and the link. And I wish everyone takes away some of the basic concepts from today's sessions that will be useful for the next sessions. And in addition to that, in the way the course is scheduled, we are going to go deeper and deeper into the different practices. So our learning objectives for the session today, we have 5 learning objectives. We want to identify the difference between some of these concepts that sometimes might be misused. So what does climate mean? Weather, climate variability, and climate change. We will also explain what the greenhouse gas effect is, and it is the root of global warming. We are going to, or I will try to provide a link between health, public health, and climate variability and climate change, to try to understand what is the reference framework that we are going to use in healthcare. And we will speak about the impacts of climate change on health based on current evidence. And finally, I will speak about the social dimensions of the impacts of climate change. Throughout this process, we are going to interact. I will ask some questions to you, and we will follow the same dynamics as we did for these 3 questions in the introduction. So this is the objective for today in the agenda. We are going to draw a conceptual framework. As you can see on screen, we will focus on health and public health. We will find the difference between climate, weather, climate variability and change, greenhouse gases, and we will introduce a very important concept for what to do and what measures to adopt with climate risk. And then we will look at the impacts and the social dimensions. Let me begin by quoting, and I see that we have a great community participating very actively. I know that we have environmental engineers, epidemiologists, biologists, physicians, nurses, geographers. Someone said we have people from the general public also joining us, administrators, people working in policy development. And I think this is great for our course. It is very important that we do collaborative work, interdisciplinary work, and transdisciplinary work. So depending on how we understand health and healthcare and the root causes of disease, these will define the work, the way in which we act. So if society doesn't share the same concept to address and to preserve the health of our population and reduce morbidity or diseases. Let me go back to the definitions that have been established with regards to health. There are different standards, and for many of the countries that are present here today are WHO members. So it is very important to look at the definition of the WHO regarding health. It involves the physical, mental, social well-being, and it's not just the absence of disease or medical conditions. The environmental aspects, not very explicit. That's why we are now focusing on it in this course. However, this is one of the definitions that provides a certain framework, and the framework that we need to consider every time we're going to carry out any initiative and study any phenomenon that can affect the health of our population.
Hay un segundo elemento dentro de este proceso de salud y enfermedad que me parece muy importante.
There's a second element within the disease health process that in a way is included in the WHO's definition of health, but it's also different. It has to do with social determinants. This means that we should be able to understand how individuals and populations live in completely different situations from birth. Also, as they get educated, work, have a working life and a daily life, that in a way is mediated by various determinants. Why social determinants? Because I think that part of the work we'll do on climate change is strongly connected. Social determinants include all the factors that mediate the fact that these populations have social, mental, and cultural well-being. There are some factors that will allow these populations, for instance, if they have access to health, education, water and sanitation, health services, decent housing, etc. If they can communicate with the populations and communities, based on all this, we can have then a larger dimension that impacts the well-being of populations. So socioeconomic, cultural, and environmental conditions are essential. We need to really understand this model of social determinants because it allows us to see various dimensions and how the socioeconomic, cultural, and environmental factors, the lifestyles of people, etc., how these factors interact and allow people to enjoy this well-being. As you know, these determinants do not necessarily depend on health, but rather on the joint work of various sectors. And this is what I think this is an objective we have in common in this course. The idea is to have intersectoral and interdisciplinary work in order to keep populations healthy. There is a further element regarding the environment, and it has to do with how we can improve the economic development of populations so that we can actually get all these factors in the model to actually take place. A meeting was held in 2012 at a conference called Rio 20 plus 20 on sustainable development. This meeting addressed health in a completely different way, a new way. They tried to include health within the environment and sustainable development. Within this reference framework and in this 2012 conference, they said that health is a precondition and an outcome, as well as an indicator of the 3 dimensions of sustainable development. Have a look at this diagram. Health is the result of the interaction of social, economic, and environmental processes. In this regard, if we compare this to the definition provided by the WHO, we can see that they complement each other, because what we define here as health is something that populations have as a precondition, but that will depend on the interaction of what happens in the social, economic, and environmental areas. I would like to provide you with this framework because it's essential for all of us to know that there are varying definitions, but some of them allow us to align some of the elements that allow us to understand what happens with climate, weather, etc. And now to round off these, broad concepts on health and public health, let us now see what we understand by public health. We all work in public health because what we want to do is to create the necessary conditions to for people to be healthy. We also need to prevent diseases and prolong people's lives. I think it is also important for all these organizations, our organizations, to work together so that we can find a way to prevent the effects of climate change on the populations. Regarding public health, we focus primarily on the social context of disease and health. So the living conditions are important to us. We need to know if people and the populations are educated, if they have access to health services, to environmental sanitation, if they have a job after getting an education. And this complements what we do in other public health areas. For instance, I'm a physician. There are physicians, there are clinical doctors as well, and they mainly focus on signs and symptoms. And sometimes the social context is not addressed in full. And the thing is that it is essential. And of course, when we talk about public health, there are great examples of how we have managed to improve the health of populations and to prevent disease as well. Some examples, for instance, vaccination, water fluoridation, screening of vaginal cytology, etc. This is a case of the COVID emergency as well. Of course, there are some mass interventions that reduce consequences regarding morbidity and mortality, and this is the vaccination scheme. However, regarding social determinants, there are other examples that also show the work in public health, which many times is not seen. For instance, mass transportation, rational use of water, education for the entire population, healthy and safe food, clean air, etc. These are all factors within the social determinant model, which are not necessarily directly linked to health in itself. But of course, they need to be considered also within other areas, education, agriculture, transport, etc. It's necessary to include all these elements in order to achieve the main aim within public health, to prolong life and also promote health. I think that all of us here now know that this is our goal as public health workers. And here I think we should include geographers, physicians, administrators, epidemiologists, everyone, because our aim is to prevent diseases and to promote health. Okay, now we're going to change subjects. Let's now dive into our topic, climate change. There are several major definitions that we need to understand so that when you start reading the papers on climate change, you can fully understand them. First of all, weather conditions. Weather conditions, climate variability, and climate change are all concepts that share something in their definitions. They are the manifestation of the dynamics of the atmosphere at a given place and time. Have a look at this image where you can see the the movement, what's happening with the clouds, and also how the air moves, how sea currents move as well. So when I say weather conditions, I refer to atmosphere conditions that are reflected in specific variables, time, temperature, solar radiation, wind, rainfall. When I say rainfall or precipitation, it means everything that, you know, falls from the sky. It may be rain, snow, hail, etc. So this shows us how the atmosphere works within a specific area and at a specific time. But there is something specific about this. When we talk about weather conditions, we talk about hours and days, and this is what meteorologists do. We do have many participants from this area. This allows us to see what's happening at a given time in a specific place in the world. For instance, in Bogota today, we have this temperature, it's cloudy or whatever, but probably those of you in Lima or Cusco will have different weather conditions. Okay, climate. Climate is a prevailing atmospheric conditions during a given period over a place or region. What changes is the time scale. When I say climate, this is not hours or days as in weather conditions. But climate addresses longer time frames after 7 or 10 days. Have a look at this chart. When I say climate, I take into consideration variables such as precipitation. I have an annual figure as well, and this allows me to see the behavior of these variables over a longer period of time, longer than 7 days or 10 days, as for the weather. It is essential for you to understand that climate is, climatological normals. These are observations over longer periods of time, generally not less than 30 years. If you are an epidemiologist, it's as if when you adjust the rates, when you take the information corresponding to the 5 previous years, and you can forecast what will happen this year, for instance. What we do use for the climate is apply a 30-year normal. What does the climate depend on? It includes 5 components that have to do with the climate system and that have to do with the atmosphere, which is a layer covering the Earth. The lithosphere has to do with the soil, the hydrosphere that has to do with salty and fresh water, cryosphere that has to do with solid water, and also there's a biosphere, which is basically formed by the human beings living on the planet. This system is based on these 5 components, and in a way, they are the fuel setting the mechanism in motion. What makes the system work is solar radiation. Solar radiation is a tool that creates a greenhouse effect, which in very simple words, allow the climate and climate variability and climate change to manifest. I would like to briefly explain the greenhouse effect. We need to remember that solar radiation is the main input in order to heat our planet. In this sense, usually solar radiation reaches the Earth. And the Earth absorbs part of that radiation, but the radiation that cannot be absorbed is emitted into the atmosphere or space. And the way in which this energy is re-emitted, this is done through infrared waves. This solar radiation that reaches the Earth, and if we had a mathematical equation, we could say that 50% of that radiation is absorbed by the Earth, and the rest is re-emitted into the atmosphere. In the atmosphere, we have different gases, steam, carbon dioxide, hydrogen dioxide, methane, etc. When we re-emit part of the solar radiation, that radiation is partly captured by greenhouse gases in the atmosphere, and they are responsible for heating the lower section of the atmosphere and allowing us to have living conditions with the right temperature conditions so that living beings can survive. But what happens when, let's go back to the process, and when we have changes in the hydrosphere, in the atmosphere, in the lithosphere, etc. And these changes have to do with human activity. Therefore, when humans have high levels of production, these greenhouse gases that under normal and natural conditions heat the Earth at the right temperature, let's say, to the right temperature, this heat increases and there is additional heat. This is why we're talking about anthropogenic climate warming, because it has been caused by humans. Within greenhouse gases, carbon dioxide has been the most studied one. Have a look at this chart showing the behavior of carbon dioxide over millennia. And you can see that the surge, the increase as of 1950. This amount of carbon dioxide has increased exponentially since 1950. These are the current concentrations. If we compare this to industrial level emissions, we're talking about 280 particles per mile. How we look at the correlation with temperature. You can see here that because of several models, mathematical and statistical models used to project how temperature changes on Earth, it is clear that if we were to analyze 1950, this amount of carbon dioxide that has increased is reflected on the number of centigrade degrees of the warming. This shows you the different percentages of the countries that emit the largest amounts of carbon dioxide. These are 2019 data where we can see that China had a 30% participation within the total amount, global amount. China is the country that produces the highest CO2 emissions, of course, but we can see other countries.
Because eventually, looking at the number of people, they have a smaller population. This is just to show a reference as to who are the highest emitters. And if I want to look at climate, if I want to look at health, those of us who are physicians, we know he is the father of medicine. But in these dates where Hippocrates lived before Christ, it was already very clear that how medicine was dealt with and everything related to healthcare, it was very important to understand the effects of the different seasons of the year, the hot weather, cold weather, the relevance of water, of soil, and the entire climate system. It was very important for him to be able to consider all of these factors and also to consider inhabitants, their habits and how they inhabited their environment. So the social determinant models was already addressed by Hippocrates at that time already, and he considered the season variability. If we also remember Dr. James Burton, the Surgeon General of the United States, who also, and looking at history, it is also important to understand that he, as a physician, he thought that the different variability in weather caused changes in the health of people they would look after in the military service. And he created the meteorological network of the United States. So health professionals, in a way, have been pioneers in using climate data to understand the effect and the impact it has on the health of our population. So we have the first poll question. What is the main difference between climate and state of weather? And there we have four choices, and I will give you a few seconds for you to select the answer that you think is correct.
Vamos a esperar unos segundos más para...
Let's wait a few more seconds. Oh, okay, it is already set. So the answer is the time scale used in the definition. So 82% of you said this is the right answer. And it is important to remember the difference. When you read different articles, it is important for you to understand whether they are speaking about weather or climate. So let's look at the other concepts that are important: climate variability and climate change. Climate variability looks at, when I speak about variability, I speak about the variation in climate, in time and space. It goes beyond weather. So climate and climate variability go hand in hand. Now, what is important, and this is what I will show you next, and it's how we use these climate mean and the changes that we can see in climate. So that slide shows a map where we can see different colors and the different temperature we are using a 30-year mean. And right here, if I look at the graph, I could say that there are different peaks year over year, but we cannot really define what's happening in this particular area to the north of the United States. Now, when I use a temperature mean in this 30-year period, which is what we call anomaly, well, I will be able to define that if I subtract it, I can find the anomalies, which is specifically when you read any type of map regarding climate variability, this is what we will consider to understand whether there has been a change or not in climate variability. As part of this climate variability, we can have seasonal, interannual variability, but probably the most popular is interannual variability through El Nino and La Nina events. What I want to show you is that these two interannual variability phenomena are mediated by changes in the temperature patterns and wind uh, speed that happen in the Pacific Ocean, therefore affecting the entire world. Right here, when we speak about El Nino, we see an unusual increase in temperature in the Pacific Ocean, and La Nina, on the other hand, will cause the opposite effect. And we will see that the conditions in the Pacific are colder, leading to a La Nina event. Right here, you can see on screen a map, a graph of La Nina and El Nino phenomenon. And this is a seasonal sequence from 1950s to date. And everything over the average, everything over 0.5 or under 0.5, all of these peaks in red are El Nino events, the years and the seasons where it happened, and in blue we can see La Nina. This is a cycle for the past 20 years. We said the cycle stretches for 5 or 7 years, might be shorter right now, and we have every 3 to 5 years El Nino or La Nina phenomenon. We are going to speak about El Nino specifically, but what I would like to say that El Nino effects are global, and it's not necessarily related to floods alone in certain areas, but rather in some regions it also causes drought. We could look at any given country and analyze it. And if we look at the map and then the second map, you can see the differences for La Nina effect. It's like a mirror effect. In one area, for example, if we look at the north of South America, in El Nino, I would have a drought event, and with La Nina, I would have floods. Why is this important? Because this shows the climate system and how it is impacted. And depending on where the populations are located, they will have different social consequences and suffer different effects. With regards to climate change, well, the definition of climate change from the IPCC is a group of experts working since the 1970s on gathering evidence on climate change, has defined climate change as attributed directly or indirectly to human activity, and it alters the composition of the global atmosphere. And we're going back to the definition of weather. Climate change is a change in the dynamics of the atmosphere measured by variables like rainfall, temperature, and so on. That basically, in terms of a time scale, I will measure it for I should measure it for at least a 30-year period. I cannot speak about climate change if I am only mapping a 1-year rainfall. I would have to look at least a 30-year period. And this is very important when we speak about health, because, for example, if we are trying to carry out any research or any study, what are the time series that we usually use in health and healthcare? Is it 30 years? We have more information when it comes to climate information sorted by geography, and it is easier to georeference smaller units when speaking about climate and weather than health and healthcare. So the first question would be, so what are we doing in terms of the health field and healthcare when speaking about climate and climate change? We do have access to 30-year period series. When speaking about different scenarios, we will use different variables like the ones that you can see on screen through mathematical and statistical models that will make it easier to understand the different weights and the different variables that are included in our projections. On screen, you can see some of the projections of the IPCC in the last year's report. They defined five scenarios based on population growth, changes in technology, adaptation or mitigation measures that might be potentially adopted internationally. And based on all of this, they will project to what would happen in 2060, 2100, 2080, and what would happen to global mean temperature. Now, in 2030 or 2040, the world will reach or will go over the 1.5 mark. In older studies associated to the Kyoto Protocol or the Paris Agreement, at the time we thought that we would go over the 1.5 mark at the end of the century. But now this report says that we will go over the 1.5 mark by 2030 or 2040. And by the year 2100, we think that we will go over 4.4. So the effects will be even more significant to what we know so far. So this just shows the information of the report and the projections as to what would happen if we reached the 1.5 to 2 degrees mark and the 4-degree mark. We're using a 30-year period or a 50-year period, depending on the availability of information. The IPCC in this report used that particular time frame and that mean. Now, what we can see is that in the polar caps is where we can appreciate the highest warming and the probability for changes in temperature changes depending on the different scenarios. In terms of rainfall, we will see higher or a lesser probability of droughts or floods, especially around the Pacific. And if we look at South America, the report shows that the scale was reduced. This was one of the problems that we have with climate change, is that most projections are global. We now have access to regional projections. And with regards to the impacts, as we will see in a minute, we will be able to look at the potential impacts by region, trying to inform public policy and make better decisions. For the same scenarios that I showed before, what the report says is that we are doing annual maximum temperature projections and also 5-day rainfall projections. This really is very useful for our health studies because in general we look at the shorter term rather than the longer term, and it would really inform our research better.
De riesgo climático, simplemente voy a poner
Bien.
aquí las definiciones.
Okay, so I will just show you the climate risk definitions. This is something that you will look at on Thursday. And climate risk is something that is based or contingent on different elements like threats, exposure, and vulnerability. Hazard, exposure, and vulnerability, and then on screen you can see the definition of the different components. Sensitivity and vulnerability, it is very important as part of the definition, and vulnerability is defined by two very important factors, sensitivity and resilience. And basically, sensitivity, it is the internal degree of fragility of the subject or the population. The person from Bajo that spoke at the beginning was very clear of the many vulnerabilities that we have across the Americas: low access to sanitation, environmental services, clean water. A lot of people using wood for fire and heat. And these are some of the social determinants. And resilience is the capacity that a system, a community, or people have to really recover from those threats and hazards. This is a summary of what we have said so far, and it shows how dependent we are on the different emissions and the projections to what will happen by the end of the century. So depending on the socio-economic processes undergoing in the different region and the mitigation and adaptation actions together with governance, that it is so important, we will be able or not to mitigate the impacts of climate change. I will ask you now to answer a new question with regards to El Nino and La Nina phenomenons, if they are climate variability expression and interannual climate variability expression, and I will ask you to answer whether this is true or false.
Bueno, muy bien.
Great. Yes, they are an interannual climate variability expression, as we said earlier.
Now we will be talking about climate change impacts. I would like to say that many times when we talk about climate change impacts, people maybe don't know the number of people affected, but when we do, then we start to react. And even within our sector, this is the case. Therefore, this is a brief overview regarding the 2003 report when we had the hottest summer since 1540, and also the largest numbers of deaths attributed to heat waves. In 2009, we had wildfires in Australia causing temperatures of 48.8 centigrade degrees. In the Caribbean, USA, and Canada, we had Hurricane Sandy, which had a record diameter in the Atlantic. Of course, there were many deaths and a lot of damage caused. Regarding other conditions and impacts, climate change has also caused the appearance of tropical cyclones, as was the case in Brazil. And this brought about other consequences such as landslides or floods, as in Colombia in 2010. Colombia had estimated losses of 4.3 of its GDP. In 2016, Chile had 8 years of drought, which set a record temperature, which was 4.6 centigrade degrees higher than the historical record. This diagram shows the effects of climate change and how they are not so direct. Regarding droughts, we might have other things happening before the impact on health. For instance, water scarcity, wildfires, mosquito population increase, etc. And this is what causes the health events we usually address. However, within public health, we should be focusing on the sectors that actually address some way or another these aspects to prevent pathologies. I wanted to show you that both droughts and floods cause intermediate mechanisms, and then we see the impacts on people's health. These are the effects that have been seen and documented in various studies regarding which vector-borne diseases or airborne diseases, waterborne diseases are related to climate change. Here we can see these pathologies that are related to different variables, temperature, precipitation, heat waves, etc. But this is just an example. When we try to, make associations between climate variables and events, one of the most explicit examples is that of malaria, where the vector cycle is greatly affected by temperature, altitude, and precipitation. But there are also other factors, these other social determinants that affect people and they become infected.
Oh my goodness. Oh my goodness. Okay.
Okay, 3 more minutes. And there are also, of course, non-communicable diseases that are related to impact, to climate change impact. This is the latest report on current and projected cases in South America. Regarding social dimension, I just wanted to tell you that the children that will be 80 in the year 2100 will have this future. Children will increase the risk of being exposed to extreme events, and the temperature remains, if the temperature remains below 1.5 degrees, and will increase 5 times if the temperature does not rise above 3 degrees. Also, almost 70% of the world's population will live in urban areas, many in informal or unplanned settlements. They might have to face chronic water shortages depending on the type of warming. they will be severely stunted due to malnutrition. If the temperature is increased to 4 degrees, the number of days of extreme heat conditions for outdoor workers is projected to increase by up to 250 working days. That's 80% of the year. Also, people living in cities and coastal settlements are projected to suffer infrastructure losses due to flooding caused by sea level rise, and the food security will be affected as well because of the sea level rise. And of course, we will have more poverty and inequality, which will lead to what we are already seeing regarding involuntary migration. And finally, this has to do with our public agenda. Several international agreements and global agreements have been implemented, but we haven't reached our objectives. For instance, in Kyoto, we said that the limit should be 1.5 degrees, but as we have seen in this talk, we will probably not achieve this objective. We need to remember that the WHO started to introduce and create plans regarding the from the public health sector. What should we do? We must do many things. First of all, we need to understand what happens globally and locally. The important thing is to identify the impact on our areas. We need to estimate the disease burden of climate-sensitive events as well, using cross-sectoral indicators. And we need to estimate risk at different time and space scales. We need to determine baselines and define early warning and monitoring system. Okay, I think we need 2 more minutes. Maybe we can answer a question or not. I don't know. Thank you, Gilma, for this amazing class. We do have 2 minutes, as you have said. Maybe what we can do in the last 2 minutes is tell you about the next steps and the lessons so that everyone remembers what comes after this. Gilma, if you agree, we will be selecting a few questions that we have already selected, and we can send out the answers later on, and we can post the questions as well, because we don't want to, you know, we want to make the most of these questions, and some people might have the same questions. On the screen, can you please go back to the previous slide? There you go. That is the next session. That is on Thursday, the 21st of April, on vulnerability and climate risk. We will have a very interesting session as well. I would like to invite you to always, you know, check the website. Haley, can you please send the link in the chat? Thank you. And there you can see the website. We will be uploading the presentations. They have already been uploaded. They will be uploaded at the end of each session, and also the video recording, so that you can watch it again if you wish to, or maybe you share the video with someone else. If you have missed a lesson, you can watch the video. We will also include these questions and answers. Haley, please keep sharing the link. Please paste it again. Thank you. Because this will provide us with the necessary space, you know, to have this conversation. So next class is on Thursday, the 21st. We'll be having lessons on Tuesdays and Thursdays for 5 weeks Today's the first session. These are 10 90-minute sessions with a brief introduction. Also, some sort of masterclass presentation, and then we will have someone working, in the field, at a ministry, in cities, so that they can give us a specific example of success stories, interventions, actions that ministries of health, environment, planning ministries have implemented. It can also be NGOs, the civil society groups, groups from the private sector, etc. We will have several successful stories that illustrate these concepts. Today we had over 900 people joining the course, and that's amazing. I think we will be increasing this number slightly until we reach the 3,000 figure, because almost 3,000 people have registered for the course. So I believe that this is a resounding success. Thank you everyone for organizing the course, and thank you for attending, and we'll meet again on Thursday, the 21st of April. Thank you very much for your attention. Gilma, thank you for your excellent presentation. I think that we have all learned so much, and I would like to give you the floor before we close the session. Thank you. I agree. Of course, I can answer the questions, and we will post the answers online. And please remember that our next meeting is on Thursday. Hope you have a great rest of the day. Thank you so much. Thank you. Bye, everyone.
You can use the
and
same
thank you.
link that you used today to log into the course on Thursday. So same link for the entire course, and we'll see you Thursday at the same time. Same link.
El mismo enlace para
So please use the same link, okay? We'll be using the same link throughout the course. See you on Thursday, and thank you for being here today. Thank you so much. Bye-bye.